each of their fields. First of all, I will start with the Minister of Health and Solidarity. Prime Minister, a few days ago I presented the first maps of France before the end of the lockdown. These maps have been tools that have guided us and will continue to guide us in the following weeks. They reflect the situation of the virus circulating on our territory, and they also reflect the extent to which our IC intensive care units are saturated in our hospitals. These maps have raised worries and hopes, but also a lot of misunderstandings, depending on whether the areas were green, orange, or red. I'd also like to repeat that if your department is red, this is not a punishment. This is also not a bad grade. It is simply an assessment of the viral situation on a given territory, which takes into account multiple data. The first indicator is that of the active circulation of the virus. The figures that we have today come from a very solid body of data that we receive every day. It comes from 700 different emergency services and account for 90% of people in emergency units. They are taken every day and they give us an overview of what has been happening every week. You have seen that and you've seen this on the maps, that the pressure of the disease has gone down. But there have been differences, some of them quite significant differences, depending on the geographical area. If you look at the map, depending on the different territories, you can see the situation. In green, you see departments in which less than 6% of people who go to hospital come there with coronavirus-related issues. In orange, it's between 6 and 10% of people in emergency services are there because of COVID. And in red, departments where between 10 and 100% of patients are treated for coronavirus-related illnesses. The situation is good in most of France. The virus is no longer active, but it is still active in the east of the country, in Franche-Comté, in Bourgogne, in Loire-et-Cher, and it is circulating much more actively in the Paris area. And active circulation has also been noted in Mayotte. The second map, which you know as well, is related to the health capacity of hospitals. Between January and March, we have increased our ICU capacity to guarantee 10,500 beds in intensive care units. Our goal now is to go back to normal capacity, which is 5,000 intensive care beds, in order to be able to take in patients who need other health procedures, and to enable health workers to work normally and to give them a break from this situation. You have to understand that the burden sustained by intensive care units because of the epidemic is very pronounced in certain areas. Given the influx of serious cases in IC units in the last weeks, this is the case in regions that were most effective, such as the Greater Paris area, Eastern France, Bourgogne-Franche-Comté, in the Hauts-de-France, in the Centre Val-de-Loire area, in Auvergne, the Rhône-Alpes, and in Mayotte. In the rest of the country, the situation has, if not gone back to normal, it has been, at least, it's become much more acceptable. The results that you can see are an average of the last 7 days. The benchmarks used for this, you can see them on the map. In green, when the occupancy rate of intensive care beds is less than 60%. In orange, when this occupancy rate is between 60 and 80%, and when more than 80% of intensive care units are occupied by people suffering from the coronavirus, they are colored in red. As you can see, the situation is quite clear. There are 3 diagonal areas in the country. The green diagonal goes from the west of the country, where hospitals are not threatened by an important influx of severe cases. In orange, the orange area, which goes from the Pas-de-Calais to the Haute-Savoie area, hospital units are more burdened by the influx of patients with severe forms of coronavirus. The red area, which is mainly constituted of the Greater Eastern area, Bourgogne-Franche-Comté, and the Greater Paris area, this area contains the most serious situation when it comes to the intensive care units. There is a third map as well, which you will discover today. This is the map of our capacities when it comes to virological testing. In January 2020, the first PCR test looking for COVID-19 was carried out. Since then, we have not stopped increasing day after day, week after week, our testing capacity in cities, in hospitals, in laboratories, in veterinary laboratories, in the gendarmerie facilities, in order to be able to identify new infections. We have reinforced our teams and our equipment in order to arm our country in testing capacity. In the last weeks, everything has been done in order to put us in a capacity to be able to test people who are vulnerable and all people exhibiting symptoms. France is ready to test massively. Our testing capacity is now at the level of the needs that need to be met. On the map here, as you can see, is very clear. But sometimes there is a gap between theory and practice, and that is why I'd like to invite French citizens who must undergo a test and who might have difficulties in order to carry out this test. I invite them to contact the green number 0800 130 0000 in order to solve the problems that they might be confronted with. As you can see, the different territories will have the capacity to test everyone. The last map is a synthesis of the different indicators. It is a sort of panorama of the situation of the French territories on the 11th of May. This map brings together the three indicators of the burden being sustained by intensive care units, by the local system of testing, and the active circulation of the disease. As you can see, many departments remain in red in the Ile-de-France area, in the Greater Eastern area, in Bourgogne-Franche-Comté. We're looking at regions and not departments because the main criteria we're taking is the breadth of the burden being sustained by intensive care units at local hospitals. And this indicator is something we saw during the outbreak, is something that is mainly measured at a regional level, not at a departmental level. The situation in the Paris area needs great vigilance. We're asking companies to use remote working as much as possible. We're asking the inhabitants of the Paris area to limit their movements as much as possible and asking people to scrupulously obey preventive measures. And when it comes to vulnerable people, please limit your outings and your contacts with other people as much as possible. In the Greater Paris area, we must be extremely vigilant. I must repeat this. Now, I know it's been very difficult for everyone these last few weeks, and I know that everyone would like to go back to a slightly more normal life. But we absolutely want to avoid a return of the epidemic, which would make the situation even worse in these territories. And that is why these are essential preventive measures that we need to respect, all of us together, collectively. This is the situation today. The elements that I presented to you are trustworthy, they are solid, but let me repeat this, and everyone has to keep this in mind. The epidemic changes over time, and what is true today might not be true tomorrow. And so I call I would like to call on your spirit of responsibility, each and all, for the good of all. Thank you very much. Thank you for the maps, for the indicators. Week after week, you said this, Prime Minister, the virus has abated. And so we can progressively ease confinement in the whole of the country. The virus has not disappeared. We must not lower our guard. In the next week, preventive measures and physical distancing will be at the heart of fighting this epidemic. Maybe even more important than they have been, since school life, economic life, social life will start up again. I will explain to you how to act in each situation. If you have symptoms that are those of COVID-19, a fever, a cough, problems breathing, or loss of smell or taste, you have to act. Do not wait for the symptoms to go away. Immediately contact your doctor, and if your doctor doesn't answer the phone, find an emergency service or call, in the last resort, call 15, the number 15, in order for them to send you to a doctor. This doctor will ask you questions and will decide whether you need to undergo a test. Sometimes you will be sent to a testing facility. It might be a drive-in test facility. It might even be something that you can do at home with a mobile team. This test will be fully reimbursed by health insurance. You will have nothing to pay for this. Waiting for the result of the test, the doctor will ask you to stay at home in isolation in order not to take risks for yourself or your entourage. If the test turns out to be positive, you will be supported throughout your illness. The doctor will contact the health insurance, who will contact you in order to set up an investigation that will aim at identifying the people you've been in contact with around you. And these people will then be contacted, these people that we call contact cases. Your isolation, if you're sick, will last for until 2 days after you are recovered, meaning on average around 8 to 10 days. If your symptoms get worse, if you have trouble breathing, if you have trouble eating, feeding yourself, moving around in your house, do not delay in calling your doctor or, if necessary, calling the number 15, the emergency services. If you, how will isolation be carried out? If you are sharing your home, you will be asked to stay in a single room, avoiding contact with other people who inhabit your house. You will have to wash your hands often. You have to air your room often. You have to avoid touching objects that may be touched by other people you share your living quarters with. And you have to clean different surfaces that are often touched, such as door handles. If you are with your partner, for example, your doctor will advise you to always wear a mask. You should not have visits except for essential visits. You will be able to get masks in pharmacies without prescription, and they will be covered by Social Security. They will be fully covered by Social Security. If your test is negative, your doctor will reevaluate the situation depending on your symptoms. Now I will tell you what will happen if you are a contact case of a person who has been infected. Usually you are not the person who will call, but you will be contacted directly by health insurance or by someone who works at the regional health authority, who will have been informed of the fact that you may have been in contact with an infected person. If the risk is serious, for example, if you shared a dinner with an infected person without respecting the physical distancing rules, you will be asked to isolate at home, just like a sick person. You will then have to avoid contacts with your entourage. You will have to take your temperature at least twice a day. If you can work from home, that's great. If you can't, then you will have to not work. 7 days after the last contact with the infected person, you will be tested yourself in the same conditions as a sick person. Why after 7 days? Because that is the right moment to be able to locate the virus if you've been a contact case. Before that first week, it might not be possible to see if you are infected. If your test is negative, the doctor would, in certain cases, allow you to ease your isolation, but your isolation will have to continue for another 7 days because one negative test does not completely exclude the possibility of being infected. Whether you're sick or if you're a contact case, if you're in isolation, never hesitate telling your doctor about difficulties you might be experiencing in your everyday life, or to the health insurance if they call you. There are local units that are being set up everywhere with the local prefects in order to be there to help you. If home isolation is if isolation at home is not possible, your doctor can propose that you spend this time in a hotel, for example, and you will be taken care of by local specialized teams. On Monday, the conditions will be set that will allow all the medical staff of the country to go back to a more normal level of activity, because protective gear, and especially masks, will be distributed in larger quantities. 100 million masks will be distributed in next week to the most vulnerable, fragilized people and health workers. We must not create a new crisis on the crisis. And so it's essential for people to go to look for help if they need medical help. I'm asking all our citizens to go back to clinics and hospitals to get the medical help they need for other health conditions. In this period, I'd like to encourage you to keep accessing healthcare remotely if possible. During the crisis, there's new ways of getting healthcare that have become very popular, such as remote medicine, telemedicine. Every week, more than 1 million remote medical meetings are carried out. And so we advise everyone to favorize these remote practices for health and for work. We've chosen to ease strict confinement for all French citizens from the 11th of May, but I'd like to advise the weakest among us, because they're sick or because they're elderly or because they have various disabilities, because they're vulnerable. Please be vigilant. Do not take health risks. Please limit physical contacts with your surroundings, with your entourage, and wear a mask every time you go outside. Maybe your grandchildren or your children would like to come and see you tomorrow. Well, you must try and limit these visits, and you must try and respect the preventive measures and physical distancing that is essential, as well as the sanitary measures, including wearing a cloth mask. Don't hesitate to contact your general practitioner, who will give you advice on the measures you can use to protect yourself. This consultation for vulnerable citizens will also be completely covered by the health insurance. And if you need to speak, because isolation can be difficult, there is a number, 0800 130 0000. We can put you in touch with the special service of the Red Cross at home. Elderly people living in nursing homes. We cannot ease restrictions on the 11th of May. People in retirement homes have to be protected most of all. Visits will be possible, but in the same conditions as they are today. In order to be able to confront this very difficult situation, the government is working with all nursing homes and has devoted 475 million euros in extra financing to them. And we want to make sure that all staff in France's nursing homes, regardless of their status, will receive a bonus for their work in this time of crisis. This bonus will be of 1,500 euros in the most difficult departments and 1,000 euros in the other departments. This bonus will be paid in the next few weeks, and it will not be subject to taxation. In the rest of the medical social sector and in the social sector, in cooperation with Julien Lormandy, the Minister, a bonus will also be set up soon. Thank you,
Minister
of Health.
I would now like to hand over